Out of Victoria, where debate is raging surrounding a so-called shadow pandemic in the state and right across the nation, suicides supposedly rising as a result of lockdowns, notably in children. But we have seen a number of false or misleading claims about the situation, so let's first begin with what the state coroner is saying. Now, when we examine an aggregated monthly frequency from the 1st of January 2017 all the way through to July 2021, we can see that the numbers are lower than every other year listed on the table, sitting at 384. Another table also shows the annual suicide frequency by age groups. The coroner's report does state that while there may be some quite substantial short-term fluctuations in suicide frequencies within particular groups, these usually even out over time. On the other hand, however, data from Kids Helpline released in June of this year shows that emergency interventions to protect young Victorians from suicide and child abuse have skyrocketed by 184% over the past 6 months, with teens aged between 13 and 18 at the most risk. Again, that data was released in early June and was in regards to interventions between December 1 last year and May 31 this year.
I would hate us to focus on just the suicide rate and think, oh, that's okay, young people aren't suffering mental health problems. Anxiety, depression, self-harm, etc. is really concerning, and we know there's been a trend very much predating COVID of an increase in problems with mental health and well-being for young people that we're now recognising. So this was predating the COVID epidemic. So I think we need to take a very broad approach. I would hate us just to focus on suicide and be thinking if the rate hasn't gone up, wow, we don't have to do very much, because we do.
We've heard a lot of people talk about a shadow pandemic in mental health. I think it's important to realise it's not in the shadows, it's real, and it is a crisis. What we have seen is a significant increase amongst children and adolescents in their mental health illness, in their suicidality, and in stress and depression and anxiety. That is a matter of enormous concern. However, at the same time, we at Lifeline are very pleased that people are reaching out in the sort of numbers we've never seen before. Year on year.
Suicide Prevention Australia now reports that 1 in 4 Aussies say they know someone who has died by suicide over the past 12 months of the pandemic. That is the equivalent of 5 million people. They say that according to the federal government's Australian Institute of Health and Welfare, while an individual's reasons are personal and often complex, overall peaks in rates and numbers of deaths by suicide coincide more or less with social and economic events such as lockdowns. For a quick comparison, Australia's annual suicide rate of around 3,300 people is currently more than 3 times that of deaths from COVID-19, which recently passed 1,000. Of course, if you or anyone you know needs help, please don't hesitate to contact Lifeline. Call 13 11 14. And for our younger audiences, Kids Helpline is also available at 1800 55 1800. If you see something you want fact checked, please also tag us on social media. Search 6NewsAU to find us, or you can email us contact@6newsau.com.